What is the purpose of the venous reservoir in a cardiopulmonary bypass system? A. To prevent blood from clotting in the circuit. B. To store blood before it is oxygenated. C. To monitor and adjust blood flow rates. D. To collect and regulate venous blood returning to the circuit. Answer: D. To collect and regulate venous blood returning to the circuit. Explanation: the venous reservoir collects venous blood from the patient, preventing excessive suction and allowing it to be filtered and oxygenated before returning to the patient's arterial system. It also helps regulate blood volume during bypass. What role does the blood warmer play in a cardiopulmonary bypass system? A. To maintain proper blood pH during the procedure. B. To prevent clotting of blood within the circuit. C. To regulate the temperature of blood returning to the patient. D. To remove excess carbon dioxide from the blood. Answer: C. To regulate the temperature of blood returning to the patient. Explanation: the blood warmer is used to ensure that the blood is at an appropriate temperature before being returned to the patient. Maintaining normothermia or mild hypothermia is essential to protect the patient's organs and prevent complications during the surgery. In a cardiopulmonary bypass system, what is the function of the gas blender? A. To regulate the oxygen concentration in the blood. B. To deliver a balanced mixture of gases to the oxygenator. C. To remove excess carbon dioxide from the blood. D. To adjust the temperature of the oxygenated blood. Answer: B. To deliver a balanced mixture of gases to the oxygenator. Explanation: the gas blender is used to deliver a controlled mixture of oxygen and carbon dioxide to the oxygenator. The precise mixture is necessary to ensure optimal gas exchange during bypass. What is the primary function of the cardiopulmonary bypass circuit's roller pump? A. To filter the blood of air and particulate matter. B. To circulate the blood through the oxygenator and back to the patient. C. To measure the patient's blood pressure. D. To warm the blood before it is returned to the patient. Answer: B. To circulate the blood through the oxygenator and back to the patient. Explanation: the roller pump is responsible for circulating blood through the bypass circuit, pushing it through the oxygenator and back to the patient. It helps maintain proper perfusion during surgery. Why is it necessary to monitor hematocrit levels during cardiopulmonary bypass? A. To assess the oxygenation of blood. B. To monitor for excessive hemodilution or blood loss. C. To prevent excessive clotting during the procedure. D. To regulate the temperature of the blood. Answer: B. To monitor for excessive hemodilution or blood loss. Explanation: hematocrit monitoring is crucial during cardiopulmonary bypass to ensure that blood is not excessively diluted by the priming solution. Low hematocrit levels may indicate significant hemodilution, while very high levels can lead to clotting complications. Which of the following components of the cardiopulmonary bypass system helps prevent the formation of thrombi during surgery? A. Oxygenator. B. Heparin-coated tubing. C. Arterial filter. D. Venous reservoir. Answer: B. Heparin-coated tubing. Explanation: heparin-coated tubing is commonly used in the cardiopulmonary bypass circuit to prevent thrombus formation. The heparin coating provides an anticoagulant effect, reducing the risk of clotting within the circuit and the patient's bloodstream. What is the purpose of using a centrifugal pump in cardiopulmonary bypass? A. To maintain constant blood pressure. B. To create a continuous flow of blood without pulsatility. C. To generate negative pressure for suctioning blood. D. To regulate the temperature of the blood. Answer: B. To create a continuous flow of blood without pulsatility. Explanation: the centrifugal pump provides continuous, non-pulsatile blood flow during cardiopulmonary bypass. It uses centrifugal force to propel blood, offering smoother flow than pulsatile pumps and reducing the potential for turbulence or shear stress. What is the most important factor to monitor when performing cardiopulmonary bypass on a patient with pre-existing renal impairment? A. Central venous pressure. B. Blood glucose levels. C. Urine output. D. Blood pH levels. Answer: C. Urine output. Explanation. Monitoring urine output is crucial in patients with pre-existing renal impairment to assess kidney function during cardiopulmonary bypass. Decreased urine output can indicate kidney dysfunction or failure, which could result from inadequate perfusion or other complications. What is the primary reason for using a blood gas analyzer during cardiopulmonary bypass? A. To measure blood pressure and monitor hemodynamic stability. B. To assess oxygen and carbon dioxide levels as well as pH. C. To detect any bacterial contamination in the blood. D. To monitor blood glucose levels during surgery. Answer: B. To assess oxygen and carbon dioxide levels as well as pH. Explanation: The blood gas analyzer is used to monitor oxygenation and carbon dioxide removal during cardiopulmonary bypass. It measures critical parameters such as PaO2, PaCO2, and pH, which are essential for ensuring that the patient is adequately oxygenated and acid-base balance is maintained. During cardiopulmonary bypass, the use of a warming system is necessary because A. To increase blood oxygenation. B. To prevent hypothermia in the patient. C. To reduce the viscosity of blood. D. To maintain the temperature of the bypass circuit. Answer: B. To prevent hypothermia in the patient. Explanation: Maintaining normothermia or mild hypothermia during cardiopulmonary bypass is essential to protect the patient's organs from ischemic damage and to optimize metabolic conditions. A warming system is used to regulate the temperature of the blood and prevent the patient from becoming too cold.